My name is Vishali Ghai. I'm a registrar at Croydon University Hospital and will be presenting a meta-synthesis on female chronic pain for the development of a core outcome set. I have no disclosures. The objective of this study was to perform a qualitative evidence synthesis describing the views of women with chronic pelvic pain. Findings were analysed using a CERQual approach with a focus that may be useful in the process of establishing core outcome sets. Chronic pelvic pain affects 15% of women worldwide and is associated with significant socioeconomic burden and long-term morbidity. Qualitative evidence is underused despite its potential to inform the care of women with chronic pelvic pain. Standard treatments often lack a holistic approach and fail to improve pain intensity as well as quality of life outcomes. The evidence used to support such treatments is extrapolated from quantitative research. However, complexities of pain sensation require research over and beyond the harms and benefits of an intervention as demonstrated by clinical trials. There has been an increasing use and emphasis of qualitative evidence synthesis that allows one to develop an understanding of health-related behaviours, experiences of illness, and evaluation and implementation of complex interventions. Qualitative evidence synthesis is the combination and analysis of individual qualitative studies bringing together multiple perspectives which may not be represented by a single study. We prospectively registered our systematic review with Prospero and included qualitative studies evaluating the experience of women with chronic pelvic pain. We excluded mixed studies and studies not written in English. We performed a comprehensive literature search across multiple databases, and study selection was performed by 2 independent researchers. We performed a quality assessment of included studies using a modified CASP tool, which consists of 10 questions assessing rigour, credibility, and relevance of studies. We also extracted study characteristics, as well as performed data synthesis and analysis using thematic synthesis. A CERQual assessment was used to assess the confidence to place in review findings. We screened 1,019 titles and abstracts and finally included 8 studies. The most common data collection method was semi-structured interviews, and the most common data analysis method was phenomenology. Our quality appraisal of included studies scored a median of 8, with a range between 7.75 and 9. However, only a single study met all CASP criteria. The majority of studies performed poorly when examining the researcher's own role and potential bias. Thematic synthesis of qualitative data generated 91 codes. These were subsequently grouped into 15 subthemes and a further 5 meta-themes. This table shows the distribution of meta-themes and subthemes across studies, highlighted by our analysis. It must be noted that studies may contribute to more than one meta-theme and also more than one subtheme. Management of chronic pelvic pain was the most commonly reported meta-theme across 7 studies containing 3 subthemes. This meta-theme encapsulates the frustrating journey of many women searching for a diagnosis and treatment of chronic pelvic pain. There was high confidence in the evidence for acceptance of pain, quality of life, and communication meta-themes. There was moderate confidence in the management of chronic pelvic pain and support. The strengths of this study include that it was the first meta-synthesis using a CERQual approach. There was a quality assessment of included studies, as well as an interpretive approach to data analysis, which meant that we simply didn't aggregate and summarise existing qualitative research, but we developed overarching constructs that go beyond the findings articulated within individual primary studies. The limitations of this study were that they were predominantly from developed countries and experiences may not be generalisable to other healthcare systems. Additionally, included studies were published between 1996 and 2008. Therefore, advances in diagnostic and treatments may not be reflected in these experiences. Our findings are a valuable contribution to developing a meaningful core outcome set in chronic pelvic pain. Our meta-synthesis revealed that quality of life is a prevalent and reoccurring theme. Our previous systematic review that documented reported outcomes in clinical trials, less than half of clinical trials evaluating interventions of CPP reported quality of life outcomes. By performing such a metasynthesis, we have generated outcomes for consideration into a final core outcome set that are priorities and reflect what is most important to women with chronic pelvic pain. Additionally, we will use women's own narratives to describe and label themes and domains. By using appropriate language, this ensures that the Delphi surveys are accessible and easily understood. Such insights have also facilitated a deeper understanding of which domains matter most to women and why. Furthermore, it's also highlighted issues with the delivery of care, such as lack of holistic treatment, delays in diagnosis, and failure of health professionals to recognise the impact of symptoms. However, this experience is not unique to chronic pelvic pain, but shared across various pain conditions. Such insights can be used to frame an overarching theme of future guidelines and inform a model of care. There should also be further attention paid to the inclusion of psychological and behavioural therapies, as this can maximise benefits achieved from treatments, as well as developing effective coping strategies among patients. There is also a wider issue of maintaining the quality of qualitative studies, as can be demonstrated by a study that only a single study met all CASP criteria. Authors should therefore pay attention to researchers as a source of bias, and piloting studies can help identify these, in which researchers can trial their proposed methods. There needs to be further research, such as primary qualitative research on areas with moderate confidence as identified by this metasynthesis, such as those centred around support and management of women with chronic pelvic pain. In conclusion, the meta-themes revealed by this review should be considered a priority and reflected in outcomes reported by future studies evaluating interventions of CPP. They should also be considered for inclusion in a final core outcome set for chronic pelvic pain. Thank you.